Hello, everyone. How are you? Good evening, everyone. So tonight we're gonna have another Facebook Live again, and I'm all very happy to see you. It's another day. It's Wednesday again on Thursday, and as usual, we're having our Facebook Live on nursing prioritization and delegation. So for tonight, I'll be giving you brand new questions, and I hope that you will learn again, as usual, about prioritization and delegation. Okay, so everybody, welcome. So before anything else, let's welcome some people in our comment section. So we have Roda Gulina. Okay, nice to meet you here. I think it's your first time tonight for the Facebook Live that we have. Okay, then we also have Paul again. Hi, uh, good evening. Then we also have Loretta. Okay, so good evening as well. So we have a lot of people joining us tonight. So thank you very much for joining us. So before anything else, everybody, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator with 25 years experience. I have always been teaching NCLEX and teaching students, nursing students. And also, I'm an author. I have a published book in Amazon. And of course, I'm the lead faculty and the president of Matus Nursing Review and also the online NCLEX Academy as well. So for tonight, we have some announcements as well regarding the what's going on with the NCLEX examination. Okay, so join me. So without further ado, let's proceed and have some announcements. So first, okay, so we have, as usual for tonight, we have the free 90-day online access NCLEX review. So for tonight, someone will win an online access for 90 days, and whoever gives the correct answer in the comment section, whatever I see in my inbox, is going to be the winner. Okay, I know that somehow Facebook or the whole comment section may have some glitches, but whatever I see on my inbox here will be considered as the winner. Okay, whoever I see. Sometimes when you review the Facebook Live, sometimes the comment section you see different people answering first. But whoever is going to be in my comment section first is going to be the winner for tonight. Okay, so get ready for tonight because I'll be asking a question, and then whoever will be giving the answer will be the winner for tonight. Okay, so another one, very important as well, is going to be the NCLEX update. So we have an NCLEX update. The NCSBN, or the National Council for State Boards of Nursing, extended the modified NCLEX exam, and that will be until September 30, 2020. So the same thing going on. You have the time limit of the exam has been shortened to 4 hours. The minimum number of test items will be 60. The maximum number of test items will still be 130. The same thing, the pre-test items and the special experimental next generation NCLEX section have been removed. And no negative impact on the candidate's testing experience or results has occurred. And also, the passing standards of the exams have not changed. So it's not easy, it's not difficult as well. So, because of the whole COVID 19 situation, this is the reason why the NCSPN extended the modified NCLEX examination. Okay, so this is a big update for all those nursing students who are scheduling their examination with Pearson VU. Okay, and at the same time applying for their licensure examination. Okay, so let's proceed. All right. So for tonight, I have prepared 4 questions for prioritization and delegation. And I would like you to put your comments and your answer again. And as usual, my goal in this short discussion will be learning the principles of delegation and prioritization. And feel free to share this Facebook Live with your friends who are also nurses, because somehow they will learn basic principles about prioritization and delegation. Okay, so before we start, just 3 people to recognize for tonight. So we have people who just came in. We have Erica. Hi, Erica. Nice to meet you tonight. I think it's your first time maybe tonight also attending. I'm not really very sure. Then also we have Anne Germain. Thank you very much also for joining us tonight as well for the Facebook Live. Thank you very much. All right. And can you please tell me where you're coming from? Where's your location, everybody? Can you please tell me what's your location? Okay, so where are you coming from, everyone? I know that Facebook Live is international. We have students from different parts of the world, but you have to remember also that our free 90-day online NCLEX Academy is international. It could be awarded to anyone, okay, around the world. So tell us where you're coming from, everyone. So where's your location? I would like to know. So Denise Germain is from Miramar, Florida. Okay, thank you for coming over here. Okay, we also have Anton. Anton is from Los Angeles. Okay, very good. I'm in Long Beach. So we also have okay, so we have from California. Okay, so we have another person. Okay, Brar. So Kirmaljit Brar is from California. We have Rose Bello. Okay, is from New York City. So nice. Thank you very much for joining us tonight. Okay, and who lives the farthest? Let's see. Okay, but anyway, I don't want to make this longer anymore, but I would like to share the comment of Loretta. Loretta said, "I got the book. I am addicted to it." So thank you very much for liking my book. Okay, so share the good news. Well, anyway, so let's have the first question for tonight. So the first question for tonight is going to be on prioritization. Okay, one of the most common situations in the NCLEX will be you'll be having a situation wherein you will be asked on what's your priority nursing action. So that's going to be one type of question. So what are the principles that you need to know when you're being asked of your nursing actions? So usually you will be thinking about using always a nursing process, always using assessment, or do you have to intervene right away? So let's go to the first question right away, everyone. Okay, so the first question that we have is all about prioritization. So this is the situation. What I would like you to do, everybody, is that please put your answer in the comment section, okay, and read the question carefully, okay. So the licensed practical nurse informs the charge nurse in the medical surgical nursing unit that the client on Coumadin therapy has an INR result of 4.3. So which of the following is the best nursing action? Okay, letter A, call the rapid response team. B, administer vitamin K. C, check the client's condition. Or D, report the result to the provider immediately. Okay? The licensed practical nurse informs the charge nurse in the medical surgical nursing unit that the client on Coumadin therapy has an INR result of 4.3. So which of the following is the best nursing action? So what are you going to do first? Okay, is it A, call the rapid response team, B, administer vitamin K, C, check the client's condition, or D, report the result to the provider immediately? Okay, so let's dissect the question, everybody. Okay, so what do you think is the answer to this question? Okay, definitely using the process of elimination, we can eliminate letter A. But you first have to read the situation, right? So your patient is on Coumadin therapy, and as usual, on Coumadin or warfarin therapy, we have to monitor the INR, or the international normalized ratio, and the goal for that is 2 to 3 for INR, and definitely this INR is high, so the patient is hypercoagulating. So which of the following is the best nursing action? So letter A, you call the rapid response team. I don't think that that would be the answer, so we eliminate that. Okay, letter B, we administer vitamin K. So always remember that Coumadin is or vitamin K is the antidote for your Coumadin, right? So that's the medication that we have to give. It is an antidote, but you think that that is the best answer. Okay, so we'll see. Letter C, check the client's condition first after receiving this result, or D, report the result to the provider immediately because it is 4.3. Okay, so what do you think is the answer, everyone? Okay, so most of you have different answers, so really very interesting, so I am very interested in your answer, everyone. Okay, so remember, we eliminate A and B because you just don't administer medication right away or call the rapid response team. Okay, now So remember, in this question, okay, what do you think is the answer? So let's see. Okay, so May said letter C. So let's find out if this is the correct answer. Okay, the correct answer in this question is going to be letter C. Very good. So some of you got the answer correctly, everyone. It's letter C. Why? Because you received the result and it's abnormal. But always remember that before you call the doctor, you need to do an assessment of your patient first because your doctor will be having questions. Okay? You don't even call the doctor right away. There's a lot of things that you have to do first. You have to review the previous labs of your patient. You have to look at your patient, find out if your patient is manifesting any forms of bleeding because your physician will be asking some questions. Okay, so you have to check the patient first if the patient is okay. All right, with an INR of 4.3, the patient may be okay, but then after that you can go and call the physician. All right, so always remember, before you call the doctor, always check your patient first for any results that are considered to be abnormal. Okay, so check the patient first before you call the PCP or the primary care physician. So very good. Yes, you have to check the patient first because the doctor all the time will be asking you questions. How's the patient doing now? With the result of the INR. So that's really very important, guys. One principle always: anything that is all about patient safety is going to be the first one: intervention. Okay, so this applies to any other situation. Check the client's condition. And if you see that the client is in distress, then you have to intervene right away. You have to do your nursing action. Okay, so if your patient has life-threatening or has life-threatening symptoms, then you have to do an intervention right away. So I hope that you learned something out of this question, everyone. Check your patient first. Okay, so very good. Now let's go to the next question, everyone. Okay, so the next question is going to be about prioritization. Now, this one is a little bit difficult. Okay, so I'm very much interested on what your answer is going to be on this in these questions, everyone. Okay, so in this question, okay, this is what's gonna happen. All right. So, the nurse in the medical surgical unit is performing walking rounds after completing the end of shift report with the outgoing night nurse. Which of the following clients should be assessed first? Arrange the following items in terms of priority. So you have to arrange or rank the following. And usually you will receive questions like this in the NCLEX as well, wherein you have to rank clients or patients based on their priority conditions. So who comes first? Number one, a 55-year-old client with right-sided heart failure who reported increased swelling in both legs. Is that the first person? Two, a 45-year-old client with emphysema who has an oxygen saturation of 88%. Number three, a 28-year-old client with cervical spine injury who complains of throbbing headache. Or number four, a 63-year-old client with multiple sclerosis who complained of leg spasms the whole night. What you're supposed to do here, everyone, is that you're supposed to rank them. So there's four answers that you're supposed to do, not only one. Okay, so you have to rank them. Is it 1, 2, 3, 4, 3, 1, 4, 3, 3, 1, 4, 2, or 2, 1, 4, 3? You have to put the numbers, everybody. So what do you think is the sequence in this situation? Okay, who do you think really comes first that you need to assess first? Who is the second? Who is the third? And who is the fourth? Okay, and in this question, everyone, so we have different answers. Okay, so we have Janine said 3142. Okay, we'll find out if that is the answer. Okay, so we also have Cheryl also said 3142. Okay, now what about the others? What's the answer? Okay, so let's proceed and see what's the answer to this. But before that, let's try to dissect the question. So in this question, everyone, you have 1, 2, 3, and 4. Okay, so the question here is about ranking in priority. And when you have this in the NCLEX, the strategy is you always have to look for the most unstable patient. Look for a patient whose symptoms represent an emergency or life-threatening condition. Okay, so remember, in the NCLEX, they will not give you the diagnosis of your patient. They will give the symptoms of the patient, and you always have to ask yourself when you're looking at the situation, Is this part of the disease process, or is this something sudden and unusual? Does this represent something, a complication that I know? Okay, so let's have the following. Okay, so the answer to this question is going to be letter, or let's say 3142. So who got the right answer, everyone? So okay, so we have France, Lely, very good. You got the correct answer. That would be 3142. Very good. Okay, so we also have another person who got it right. Okay, so Pratiksa got it right as well. Very good. So it's 3142. Why number three first? Why? Because number three, a client with cervical spine injury, if you listen to my discussions in the videos, one of the most favorite concepts in the NCLEX is the autonomic dysreflexia, right? And in autonomic dysreflexia, if you have a cervical spine injury, any injury above the T6 will cause you to be prone to autonomic dysreflexia. And that is characterized by a very high blood pressure, okay, severe throbbing headache, okay, and that can cause the patient to develop stroke. So it is a medical emergency. You want to check the patient first, what's going on with the patient, because you need to intervene right away with number three. Okay, so autonomic dysreflexia. Later on in the comment section, I'll post a video about autonomic dysreflexia. Okay, now next we have number one. Yes, that's correct. Yeah, Gertie, Sylvester, that's going to be autonomic dysreflexia. Very good. All right, so next will be number one. Why number one? Because there is a client with right-sided heart failure with leg edema. But remember, leg edema is part of the manifestation of heart failure. But why is it number one is the next one? Okay, why is it the next? Because of the word increased swelling in both legs. So when you have a change in condition usually could be something that is sudden, something that is acute, something that is not part of the condition. So when the client says increased leg swelling, then you have to be worried a little bit, because it could be a sign that the client is having more fluid retention now, or the condition is getting worse, or the heart failure. So with the word increase, that becomes a little bit of priority, and you have to check the patient and find out what's going on with that patient. Okay, because that patient may be retaining fluids already, which is of course happening probably with that patient. Okay, so we also have the next one is number four, a 63-year-old client with multiple sclerosis complaining of leg spasms the whole night. Okay, so you also check that patient, but remember that those patients with multiple sclerosis, they do develop a pain related to spasms. That's kind of like part of their symptom, or disease process, the spastic pain. So number four, and the last one will be number two, a 45-year-old client with emphysema who has an oxygen level of 88%. So this goes back to your concept, clients with emphysema or COPD, our oxygen saturation range that is acceptable for them is only 88 to 92%. We cannot give them anything. We cannot have a goal that is beyond 92%, like 93% or 95%. Remember, those clients with emphysema or COPD, they have what you call the hypoxic drive. What makes them maintain their respiration is because of the low levels of oxygen. So it is not alarming if the auto saturation of someone with COPD is only 88%. Okay, if number two has an auto saturation of 70%, 70, then that becomes the priority because it's an oxygenation issue. Are you listening to me, everyone? If I change number two, the auto saturation is 70%, then that's a different story. The number two becomes the priority. So that's why it's really very important to have a very strong content. Content. Don't work backwards with your NCLEX. You need to have a strong content, because in the NCLEX, that's the one that's really important. And all of these things are things that I provide in my online NCLEX Academy. I really explain everything. I cover everything like a nursing student, because content is really very important, everyone. Okay, so the answer is going to be number 3142, and I hope that you learned something about this, everybody. Okay, so thank you very much for that. Now let's go to the third question, everyone. Are you ready for this? One of the most scary Okay, or let's say the feared question in the NCLEX is your SATA. So who among you here are afraid of SATA? What can you say about SATA, everyone? Okay, so shout out to SATA or select all that apply. All right, what's your fear level with the SATA? But anyway, SATA could be a little bit scary in the NCLEX. But again, if you know your content, you're gonna be okay. All right, so no need to be afraid. So just make sure you know your content and slow down in answering the question. A technique in answering the SATA question is to treat each item like a true or false question, okay? And use the process of elimination. So be careful, all right? So let's have a SATA question, everyone. Okay, so someone said, Babita, it's scary. Yes, it's scary, but then always remember that, you know, in the NCLEX, they don't trick you. In the NCLEX, it's either you know it or you don't know it. So you really have to know your content. Have a very strong content, everyone. Okay, very important is going to be your content. Okay, and then your test strategy, of course. So let's have a select all that apply on delegation. Okay, so let's have the question, everybody. Okay, so the registered nurse or RN works together with the licensed practical nurse or LPN in the clinic. Which of the following tasks can be properly delegated to the LPN? Select all that apply. Okay, so all right, select all that apply, the tasks that can be delegated to the LPN. Okay, so is it A, administering gentamicin drug intramuscularly, B, obtaining vital signs of clients with colds, C, initiating a new care plan for a client with urinary infection, D, administering flu vaccine injections, or E, drawing blood from the central venous line. So you have select all that apply question here. That would be A, B, C, or D. What do you think will be included, everyone? Okay, so remember, you have to know the scope of practice of the licensed practical nurse, especially the state where the LPN is working or is licensed. Okay, because every state has different scope of practice for LPNs. All right. So is it going to be A, B, C, or D? All right. So what do you think? Okay, would be part of the or the scope of practice, or let's say which one can be delegated here. Okay, so let's proceed. Registered nurse working together with the LPN. So which one can be delegated? All right, so let's see. Okay, so I'll be giving you the answers, everyone. So let's see the answers of some people here. So we have Sweatcell is going to be ABD. Okay, so we have also another one. Kim says ABD also. Okay, so Hazel also says ABD. Okay, so let's proceed. Well, basically, everyone, those people who answered, okay, A, B, D are actually correct. Yes. So that would be A, B, D. Congratulations, everyone. That would be A, B, and D. Okay. So A here is administering gentamicin drug intramuscularly. Is that the responsibility or part of the work of the LVN? Of course, the LPN gives intramuscular medications, right? Not intravenous, but intramuscular medications can be given, correct? So A is correct. Yes, you give gentamicin, IM. That's an IM medication. We do that. Letter B, obtaining vital signs of clients with colds. Of course, if clients have colds and the LVN can take their vital signs. Yes, that's no problem. That's part of your training and practice. Okay, but the interpretation and analysis of vital signs, if they are abnormal, should be the responsibility of the registered nurse. Okay, the interpretation. Now, letter C, initiating a new care plan is for a client with urinary infection. Remember that creating a new care plan is always the responsibility or the scope of practice for the registered nurse. Okay, the LPN can make suggestions probably, and the LPN is the one carrying it out, but the development of a care plan is going to be the registered nurse. All right. And then letter D, administering flu vaccine injections. Of course, we give flu vaccine injections. That's part of the scope of practice of LPNs. And letter E, drawing blood from the central venous line. Definitely, that will be for the RN. Okay, especially central venous lines. So I guess that most of you, okay, got the answer correctly. Okay, especially central venous lines, guys. Usually that would be for the registered nurse. Okay, so thank you very much for answering those questions, everyone. Okay, or this question, everyone. Okay, so let's have another question. All right. So we have the last question for the night, everyone. But of course, these are only a few questions, but I hope that you learned, and then we do this as often as we can. All right. So last question for tonight, and this is the contest for tonight. Okay. Whoever puts the correct answer in the comment section, the first one who puts the correct answer in the comment section will be the winner. Okay, whoever is that person that I see on my comment box over here. Okay, so whoever is that going to be? Okay, so you have to put the correct answer in the comment section, and this is again a select all that apply question. Okay, are you ready, everybody? Can I have a shout out from everybody? Okay, all right. Okay, so are you ready for our contest, everybody? Are you excited? Okay, this is going to be the last question, and you have to put the answer right away. Remember, the mechanics is if you win and you're already enrolled in the online NCLEX Academy, you can actually give this out to someone or any person that you know, okay, or nursing graduate. All right, so Frida said she's ready. So let's see who will win the another 90 day. Remember this 90 day promo is not gonna last. Okay, the free access. So we're not sure next week if there's another one again. We will find out. Okay, so this is the question, everyone, and give me your answer right away. Okay, select all that apply question. Okay. So the charge nurse in the critical care unit is assigning tasks to three unlicensed assisted personnel or UAP. Which of the following responsibilities can be safely delegated? Select all that apply. A. Turning the client with intracranial pressure monitoring every 2 hours. B. Changing the diaper of a client with Clostridium difficile infection. C. Emptying the colostomy pouch of a client with colon cancer. D. Assisting a client with Parkinson's disease during ambulation. Or E. Monitoring the hydration status of a client with acute renal failure. Okay, this is select all that apply question, everyone. You're only allowed to put your answer one time. Okay, you're only allowed to put your answer one time, everybody. Okay, so let's see who puts the answer first. Okay, so if you already have the academy, everyone, okay. So let's see who puts the answer first in this activity that we have for tonight. Okay, all right. So what's the answer to this question? Let's see. Okay, so who answers first? Based on what I see on my live feed, everybody. Okay, I'm going back to my live feed over here. Okay, so the first person, okay, who got the correct answer is going to be, all right, on my live feed. Okay, so I'm gonna give you the answer to the question now, everyone. Okay, the answer to the question is going to be B, C, and D. This is the answer, everybody. Okay, so in this question, B, C, and D, let's see who won this one. Okay, who am I seeing in this live feed? I think that the person that won this contest is the same person I guessed last week. Also, it's Janine Lubaton. So I think she's the one who won again. Okay, based on the who appears on my feed, everybody. Okay, so Janine is still the same winner like last week. Congratulations for answering correctly. Okay, that would be B, C, and D. So she's the same person who won the 90 day. 90 day. Okay. We'll extend Janine's um, access to the online academy. But since she won last week, we're also gonna give another 90 days. Okay. So who is the next person that got the correct answer, which is also B, C, and D, aside from Janine? That is Freda Villanueva. So Freda also got it correctly. So that's going to be B, C, and D as well. So she got it right. Okay. So for tonight, we have two winners. So we have Janine Lubaton, and then we also have another one. We have Freda Villanueva. Can we congratulate them, everybody? Okay. So let's explain first the rationale for this question. So remember that you cannot delegate to the UAP a person who has intracranial pressure monitoring, okay? Because that patient is considered to be unstable, all right? Intracranial pressure monitoring. Now, but changing the diaper of a client with Clostridium difficile infection is part of the scope of practice of the LPN of the UAP, also emptying the colostomy pouch as well, and also assisting the client with Parkinson's disease. Letter E, with the word monitoring, monitoring means evaluation. So we're not supposed to, okay? We're not supposed to delegate that to the UAP because it requires critical thinking, okay? So in that question, your letter E, okay? Remember, RNs cannot delegate uh, anything that requires complex critical thinking to the UAPs. Okay, so that would be your monitoring represents assessment. So that's why B, C, and D is the answer. So I hope everyone you've learned something about this. So the key principle that you need to know is review the functions of the UAP. It's not enough to know that it is within the scope of practice of the UAP. It's very important also to remember if the patient is stable or unstable. Okay. With letter A, repositioning is part of the responsibility of the UAP, but it is an unstable patient. Okay. And letter E, that is not a routine procedure. That is more of assessment, and that is the responsibility of the registered nurse. So thank you very much, everyone. We would like to congratulate our winners for tonight. That would be Janine and also Frida. So you both get additional 90-day free access on our online NCLEX Academy. And then I do have an announcement tonight, everyone. Okay, so I have a special treat to everybody. For the next 24 hours, we're gonna have a 50% off on our 12-month self-study comprehensive online NCLEX review. So it's going to be 50% off. Instead of $499, it's only going to be $249. And that's good only for 24 hours. So we will close the cart after 24 hours. So if you purchase right away, you get a 50% discount. Okay, so you just enter the coupon code of 50 half off at checkout, and you will of course save a lot of money for this one. So 50% off our 12 months self-study comprehensive review. Okay, another one we have of course also, if you purchase the 50% off promo, and if you live in the US, we will send you a free copy of my ebook in Amazon. So if you live in the US, you will receive another copy, an ebook copy or electronic copy of my ebook in Amazon. Okay? And lastly, another assignment, everybody, or announcement, everyone, is okay. So we have been conducting the group NCLEX virtual coaching call in our Facebook group. This is an exclusive group for our Matus Nursing Review online NCLEX Academy students. So students that are enrolled in our program can be part of our Facebook group, and also regularly I do additional coaching there and discussions on delegation and prioritization. So this is additional support that students get from being enrolled in the program, wherein I conduct a coaching call in Facebook Live, which we will start next week. Okay, so last night we just had a session with some students, and they really enjoyed the session that we have on delegation and prioritization. And of course, it includes also some updates about the NCLEX and just really supporting each other and inspiring each other as well. Okay, so feel free to enroll, and then you can get this additional support from our online academy with our Facebook group. Okay. All right. So okay, so thank you very much, everybody, for being here tonight. I hope that you enjoyed, okay, our short session for tonight. And I would like to check out some people in the group, okay. We have Franz Elil, thank you very much, okay. We have, okay, we also have Amy. Thank you very much, Amy. You said, I have your book, it is so great. Thank you very much, okay. We also have, okay, we also have Maria Ruela Valencia as well. Okay, so thank you very much for joining us tonight, and congratulations to the winners. And the winners are the ones who appeared on my Facebook group. Okay, so maybe next time we'll change the mechanics, but for now, that will be the winners that we have for tonight, because they are the people who appears on my comment section. Okay, so thank you very much, everybody, and have a great night.